As a high school student, I was on the Canadian Junior Pan American team for Javelin. I was also on the national team. After I graduated, physical symptoms started to occur. I was put off work in 2012. I lost 30 pounds in 4 months from just using the bathroom. So I was getting GI scopes, I had colonoscopy done, I had CAT scans done, ultrasounds done on all of my organs in that 8 years of getting medical tests done, and they're all coming back normal.
There is that philosophy that, hey, yeah, we got to keep investigating and keep referring until we get to a diagnosis, and then we'll know what to do. But you get people that have a whole host of what I would call inexplicable symptoms, and you just really don't know what to do and how to help them.
When I was put off work without a diagnosis, being at the age of 25, it just was so unreal. Like, it just didn't make any sense to me.
It almost seems better for me not to send patients off in too many different directions, too many tests, too many specialists. Regardless of what's wrong with the patient, ICCS may be able to help with them.
The Integrated Chronic Care Service, we receive patients that are fairly complex because they have multiple chronic conditions, they have multiple symptoms and many body systems.
There's the ones that have the environmental illness. There's patients who have multiple chronic conditions, and then there's another group of patients who just have a lot of symptoms, and it's very hard to sort through that and actually arrive at a diagnosis.
They are still in our healthcare system because they are seeking something, and that something has not been met. So for them to again come and be referred to our service and having to wait is non-value added. We used to be more than 5 years wait times.
The wait time was such a significant thing for a lot of patients because they've gone through so many different specialists. They've already gone through so many different treatments, and they've really struggled with that. And by the time they got to us, really what we saw is that they had very little hope.
Asking for help and not being able to receive it is such a difficult thing. You just keep going. Like, for me, there was not a point that I'm gonna give up. I could never give up.
How can we improve patient engagement, and how do we improve their health outcomes? And that is the My Care, My Voice initiative, where we said we would look at different ways to include patients' voice in our care delivery process. It was as simple as introducing a survey that talks about their hope and needs. And they tell us that, you know what, I just need a medical diagnosis, or I just need to get through my day.
We say, you know, this is not a hierarchy, this is something where we're working together. We'll bring our skills as clinicians in terms of what we know, but the patient brings their experience, and really we need to find ways to mesh that.
The old way of doing business was to sort of nurture the patients and keep looking after them. The newer way of business is to kind of encourage the patients to look more after themselves and give them the tools to do that.
So what we've done is we've put in 3 groups prior to coming in for that medical appointment and the coordination appointment. We are trying to determine, are they going to be coming through our full rehabilitation program, or are they coming in for something very specific? And if that's the case, we're going to triage them through that.
For me, where I was off work and underweight, I was able to get in a month and a half.
So we didn't have to add any extra resources. There were no cost increases because of this. We actually were able to take our existing resources and better match them to meet the needs of our patients.
Just making sure that the patient has a voice and they feel like they have some hope and confidence in terms of what they're doing at ICCS.
The difference from that to going to your family doctor is just unbelievable, because they're so open-minded, which was the biggest and the most helpful thing for me.
Quality is about satisfying your customers, it's about cost, it's about patient experience, it's about your provider satisfaction as well. So when a care team also feels like they're doing the best they can, that is an ultimate reward in itself. But then to have a national body then recognize your team for what they have done, we feel fantastic about it.